Hello and welcome back to my YouTube channel. I'm Tenzing, your host, and today we have a very special patient who has flown all the way from the United Kingdom and he has come specially to show Dr. Vijayan Govinda Gupta for a penile implant. So let's get straight to the point and meet him. Hello Mr. Marvin, thank you and welcome to my show.
Hi, how are you? You're right.
So you are a spinal cord injury patient.
Yes, correct.
So what made you go for penile implant?
I was using like medication and drugs for about 10-15 years, but they were just not starting, they wasn't working after 10-15 years. I wasn't getting the same effect. So yeah, that's why I went for the penile. I looked online, I see doctors' reviews and watched these videos on YouTube and decided to get the Indian penile implant.
Okay, so you are saying that the spinal cord injury made you you got an ED because of the spinal cord injury,
yes,
right?
That's what caused it, yes.
Okay, so you did have medicines for how many years?
About 10 to 15 years. They just, I needed to take more and more as the time went on, and in the end they didn't work properly.
Okay, so you increased the dosage and
yes.
after a point it stopped working.
Yeah, that's correct.
All right. So why Dr. Vijayan Govinda Gupta?
Because he had a lot of videos of him actually doing surgery on YouTube. So you can actually watch it and see what he does. And he was very hot on infection, because infection is the main thing, do you know what I mean? So because he was like, he said that he's very specialized in not making patients get the infection. So I just went with him. I'd done a bit of research on him and decided to go for it.
Okay, and besides that point, he's also one of the highest implanters in India. Okay. So that's just a fun factor for patients. He does around 10 implants a day, which is one of the highest numbers. What about, so how was the surgery? Was it successful? How was the whole process?
Yeah, well, obviously I've had the surgery today. It was sound. I come yesterday, had some blood tests, went back to my hotel, came back today, got prepared, had the cannula put in and got put down and woke back up. And
you're good to go now, right?
Yes, yeah, I'm
okay,
cool.
Great. So what did the doctor recommend? I mean, did he say that you need to stay for another 2-3 days?
Yeah, I've got to come back tomorrow. I think is it to get it dressed. He said he'll decide then, like, I don't know, maybe a couple of days, and then I can go back.
So as I said before, the penile implant is a very short surgery. The doctor does it. It's a daycare procedure. We have the patient come in one day before. He comes in for the surgery the next day, and then next 2-3 days he's good to go. He can even travel around. You have any plans to travel around?
Yeah, I'll go and have a look around when I feel. I'm going to rest for the next couple of days, but yeah, I'll have a look around and see what's going on.
Yes.
I only come here. I actually only landed yesterday, so it's quite a quick turnaround.
Yes. And United Kingdom is not very far, so around 7 to 8 hour journey.
Yeah, about 7 hours. Yeah. 8 hours.
So yes, we have this patient who's come from the United Kingdom. He has erectile dysfunction problems, and he has gone for the penile implant with Dr. Vijayan Govinda Gupta. It's a very easy process. We have patients who fly in all the time. It's a daycare procedure, and the patient needs to stay for next maximum 5 to 7 days for the surgery. If the patient doesn't have much time, 3 days is more than enough. He's just in and out. He's good to go. So all right, thank you so much, Mr. Marvin.
No problem,
thank you for coming to my show, and I will connect with you guys in the next video. Thank you so much.